Okay, today we're going to be discussing and testing for the cranial nerves. First, we're going to verify the patient's name and date of birth. Your name, please?
Andy Morgan, 11/27/85.
Okay. I'm Brittany. I'm a student nurse, and I'm going to be checking your cranial nerves today.
All right.
Okay, so we will not be testing for cranial nerve 1 today. Cranial nerve 2, the optic nerve, we're going to first test your peripheral vision. Okay, so what I'm going to have you do for peripheral vision, you're going to cover one eye with your hand. Okay, I'm going to put my hand behind you. I want you to tell me when you see my fingers.
No. No.
Good. Other side. Go ahead and cover.
No.
Good.
No. No.
Good. So if we were in the clinic, I would have him test for the Snellen chart for visual acuity. I would have him stand about 20 feet away from the chart. I would ask him if he wore glasses or contacts. If he did, I'd have him wear them. I would have him read the lowest line with one eye covered. Then I would have him read the lowest line with the other eye covered. And then I would have him read the lowest line with both eyes open. I would then score him with whatever fraction of the lowest line that they could read. They couldn't miss any more than 3 letters of each line, or they would have to read the line above. Normal vision's 20/20. Cranial nerve 2, the optic nerve is intact, so we will move on to cranial nerve 3. First, we're going to test for cranial nerve 3 the 6 cardinal fields using the 6 cardinal fields of gaze using the NH pattern. So I'm going to have you look here. You're just going to keep your head still and you're going to follow my pen.
All right.
Very good. I'm not seeing any nystagmus. Next, we're going to test the direct and indirect pupillary response. You're just going to look forward. Good. His pupils are equal, round, and reactive to light. Bilaterally, cranial nerve 3 is intact. All right, next we're going to be assessing cranial nerve 4 with the trochlear nerve. We're going to test for a combination to make sure the eyes go inward and downward. So you're just going to look here and you're just going to follow the pen towards your nose. Very good. Cranial nerve 4 intact. Okay, next we're going to test cranial nerve 5, the trigeminal nerve. First, I'm going to have him clench his jaw. What I'm looking for here is good symmetry and movement. Next, I'm going to have him open his mouth against resistance. Very good. The sensory portion of the test, we would test with a cotton ball. We would test the face, the scalp, the cornea, and condition of the mucous membranes and the nasal membranes with a cotton ball or like a Q-tip. We're not going to be doing that today, and overall, cranial nerve 5 is intact. Cranial nerve 6, the abducens nerve, test for the lateral movement of the eyes, and that was already tested in cranial nerve 3 testing, so cranial nerve 6 is intact. Okay, the next nerve we're going to be testing is cranial nerve 7, the facial nerve. To do this, we're going to have him clench his jaw. Very good. Next, you're going to close your eyes tightly. Good. Relax. I'm going to have you state your full name.
Andy D. Morgan.
Okay, smile. Frown. You're going to keep your lips together and puff your cheeks. Good. I would test for taste of the anterior 2/3 of the tongue by having him taste salty, sweet, and sour foods. We would test for the tears by stimulating the cornea with a cotton ball and by giving him sour food. That won't be tested today. Cranial nerve 7 is intact. Okay, the next nerve we're going to be testing is cranial nerve 8, the acoustic nerve. We're going to be testing patients' hearing. So I'm going to have you cover one ear. I'm going to come behind you. I'm going to whisper a 2-syllable word, and I'm going to have you repeat it to me.
Football.
Very good. Go ahead and cover the other ear.
Baseball.
Very good. Cranial nerve 8 is intact bilaterally. Cranial nerve 8 would also be equilibrium testing, and we'll be testing that using gait, and we'll do that in the head-to-toe assessment. Okay, next we're going to test for cranial nerve 9, the glossopharyngeal nerve. I'm going to have you open your mouth and say ah, stick out your tongue. Very good. I would then test the gag reflex with a gloved hand. However, we won't be doing that today. Cranial nerve 9 is okay. Next up is the cranial nerve 10, the vagus nerve. What I'm going to have you do is I just want you to say your name and date of birth.
Andy Morgan, 11/27/85.
There is no hoarseness in his verbalization. Please swallow. Very good. Cranial nerve 10 intact. Okay, next up, we're going to be testing cranial nerve 11, the spinal accessory nerve. What I'm going to have you do is push towards my hand with resistance. Very good. This way with resistance. Back with resistance. Good. Forward with resistance. Go ahead and shrug up against my hands. Very good. Cranial nerve 11 is intact. Okay, and lastly, we're going to be testing cranial nerve 12, the hypoglossal nerve. I'm going to have you open your mouth, stick out your tongue, move your tongue side to side. Very good. Cranial nerve 12 is intact. And that concludes cranial nerve testing. Cranial nerves 1 through 12 are intact.